Hi everyone, welcome back to our channel. And in lieu of Bendrick matching into residency, we're going to be giving you 5 tips and tricks on how to be an amazing away rotation student.
Tip number one is to be professional. It kind of goes without saying, but this is essentially a 2-week to a month interview at your preferred residency site, and I think it speaks a lot to how you act on rotation, and that's how the residents and the PDs and attendings will see you. So be professional, show up late. I'm sorry, show up early.
Are you showing up late?
Show up early, work late if you need to, and be professional all the times. And then I think one pitfalls that med students tend to fall for is when residents or attendings start to complain, and med students start to join in on the complaining. But don't do that. As a big red flag. Be respectful to everyone you meet, including people who are not on the medical side, like custodians or cafeteria workers.
And just to expand on that, I have actually seen med students not matching because they're bad mouthing another residency program or they're bad mouthing another resident or medical student. And so you really have to be professional at all times. Even if the residents are bad mouthing someone, you do not want to join in. You want to stay neutral but empathetic to how they're feeling.
Yeah, don't let your guard down.
Tip number 2 is that on top of being just professional, you want to take the extra step and be an optimistic and pleasant person to work with. So what does this mean exactly? So even when things get really stressful, and things will get stressful, especially on inpatient rotations, you do not want to be a Debbie Downer. You want to stay calm, collected, and optimistic about having the opportunity to see more patients. Because the big thing that they're testing you on is how well you work under pressure and under stress. Another thing about taking the extra step is even when you're rounding on patients who are not personally your patients but are the residents' patients, you still want to be engaged and involved. So ask questions throughout rounding, even if they're not related to your patients. The biggest point here is your reputation goes a long way. It's not just getting into the residency program, but it will follow you throughout becoming an attending and landing your dream job. And as Bendrick said, your reputation really doesn't only depend on how you treat the other residents or med students or healthcare team, but also all the ancillary staff, including social worker or case manager. Basically, anyone in the hospital you should be respectful to, and not just because you want a good evaluation, because you're actually a good person and you want to be respectful to everyone.
So tip number 3 is to be proactive. What do I mean by proactive? Being proactive means that you are a team player. You anticipate what the residents' needs are. So for example, when I was on rotation, I would anticipate the needs of the residents. If you need to reach out to surgery or medicine or other subspecialties, I will quickly jot it out on my notepad or paper, what have you. And when after we're done rounding, we make sure to ask the resident, hey, I have nothing to do now. I can reach out to these people for you, keep in the loop. And or you can be like, hey, message nursing and be like, hey, we're gonna do this X, Y, and Z for this patient. Just wanting to let you know. And these are all small little things that the residents do. If you do that for them, that can really alleviate a lot of pressure on them, and they can actually focus on the big picture things. So remember, you as a medical student, when you're on rotation, your job is to make the residents' life better and be a part of the team player. The residents are your biggest advocate for getting to residency. Sometimes attendees don't really see what you do, but they listen to residents and see residents every day. So make sure that you are working well with the residents.
Just to piggyback off that, as Bendrick was saying, when he says help the residents do little tasks here and there, it's not just for your patients that you're taking care of, but also for their patients. So on rounds, listen in on what the attending is saying, even if they're not presenting on a patient that's yours. If they're presenting on the residents' patients and the attending is like, hey, can you call the lab for this patient to check when this blood work will come back? Or, hey, can you call radiology to get a what read on this imaging? So even if they talk about a patient that's not your own, when you are done with the work of your own patient, you can be like, hey, resident so-and-so, I know that Dr. blah, blah, blah wanted you to call the lab to check on this pending lab value. I'll do that for you because I'm done with my work. So it just shows that you're very, very proactive Tip number 4, and I know that you guys have heard this a lot, take ownership of your patients. But to go a little bit deeper than that, what taking ownership of your patients means you know pretty much everything about the patients. When you're thinking of your assessment and plan, do not just blindly follow what the resident said the day before. Be active and think about what plan you want for the patient and why. The big thing about this is using evidence-based medicine. So using all your resources, up to date, open evidence, anything that you need to use in order to support your plan of why I want this plan for my patient. And taking ownership also extends beyond just patient care. If you have a patient that is a really interesting patient, you can even volunteer and say, hey, I think this patient is really interesting. Why don't I write up a case report on this patient? Or maybe I can present this patient on, what's it called? On morning case rounds. I forget what they're called. You know, like the morning things that people do? Morning.
New conference? No.
Yeah, maybe. What I did on my away rotation at the program that I really wanted to match into was I presented that patient's case during the morning case presentation rounds. So you can even volunteer to do things like that that are outside of just the typical rounding and day-to-day activities. And you can even print out papers and teach the residents, like, hey, this is a new journal article that came out related to this patient, so I wanted to share the findings. And all of this goes without saying, you do not need to have the full knowledge. You do not need to know everything. I am just starting attending life and I don't know everything. So the biggest thing is that you are working hard and you want to be a lifelong learner and you're looking things up. It doesn't mean you have to know everything right off the bat.
So the last tip, number 5, is to do all of those what we said earlier, like you really want to. It's really easy for residents and attendees to tell if a med student is just here just to get a grade, or they don't seem interested at all, or they're really a big gunner. Residents and attendees have been med students before they have been in those positions, so this is very easy to pick up. You're not as slick as you think you are. So be genuine. Actually do want to take care of the patients, and those things will reflect daily, and residents see that and then they can vouch for you getting into residency. That's your preferred program.
And another thing about being genuine is you do not want to try to outperform your co-med student just because you're trying to get a good evaluation. So do all the tips that we discussed because you genuinely care about the patients, because at the end of the day, you went into the healthcare field for the patients. You want to take care of these people who are sick. You do not want to be throwing your co-medical student under the bus or trying to do better than them or make them look bad just to get a good evaluation. Also ask for feedback because you genuinely care and want to do better during this rotation and the next rotation. And then just a reminder to all of you guys that it is a tiring road, and when things get tough, just think about why you're doing this. You're doing this for your patients. You're doing this because you care, and you're doing this because your patients need you.
These are all tips that Shannon, my wife, told me before I started my away rotations, and I followed them as best as I could, and I'm matching to my top residency. So listen to her. She is a gold-minded advice, and I'm just here to echo what she taught me and see the fruits of the labor come out.
I hope that was helpful. If it was helpful, we hope you can like, comment, and subscribe. And if you have any other additional questions or comments, please don't hesitate to comment below, and we'll try to get to your comments with our advice and tip and answers.
If you want any more PMR specific advice, also let us know and we can do another separate video for that.
Good luck to all the M4s. We're so proud of you for getting to where you are and getting through the 3 years of medical school. But you guys got this, and we're so proud of you. And we say goodbye.
You said so proud twice. We're so proud of you, M4s, that you guys are amazing. You guys suffered for 3 years and you realize that end of the tunnel. So you're almost there. Good luck to all the M4s. This is going to be an exciting plus stressful time of your lives. But keep at it. You guys will do well. We are so proud of you for making such great progress and to be where you are right now.
And it is a very long road, but it does fly by, especially residency. And why are you holding it like close to your finger like this? Like you're just like this the whole time.
I don't know. It's comfortable.
Huh? So we hope you enjoyed this video, and we hope that you stay tuned for more videos that we'll potentially do in the future on more advice for other things like how to study for step 3, how to do well on interviews, and that's that. Bye. Hey, no heart fingers to anyone.
Oh.
Only me.